Hello, I'm Dr. Linda Herkenhoff. My colleague Joanne Heydenfeldt and I are very happy to be able to present some exploratory work we've been doing in connecting decision making with data analytics and mindful awareness. Thanks so much for this opportunity to still remain part of the conference, although we're doing it virtually. Who is St. Mary's? Well, we were started back in 1928. We're in Moraga, California, kind of tucked away in the beautiful hills. We've only got about 213 faculty, about 4,500 students, most of whom are undergraduates. Joanne's expertise is in the area of organizational behavior and applied psychology. And I am the director of our global MBA program, but I am also a professor in the analytics department. Today we're going to go over some very basic definitions, a little introduction to the subject. We have some basic models, and then hopefully we come up with some conclusions and what the next steps would be. We're not going to put a lot of definitions up here. The subject has many moving parts, but I think we have to be really clear on what we're talking about when we say data analytics and mindful awareness. These are the two biggest components we're trying to bring together. Data analytics, obviously the science of analyzing data in order to make conclusions about that information. And as we get into the whole mindset of big data, it's really important that we understand the integrity of the data we're working with. Mindful awareness, also shortened to mindfulness, is defined by an enlarged capacity to be aware of conditioned reactions. It's important to understand we're talking about in ourselves and in others. And it's the ability to choose new responses. So for those of you familiar with emotional intelligence, the first part of this definition applies to that. But when we add in that expanded definition of mindful awareness, we're really talking about the ability to choose new responses. Decision making, what do we know? Well, data and our gut should go hand in hand. Data informs the decision, but decisions can't be made in just a vacuum of data. At the same time, decisions based on gut should always be supported by data. The reality is our decisions are not driven by data, they're informed by data and are based on several variables beyond data. Some of those are somatic markers such as intuition, our past experiences, judgment, context. I'm sure you can think of a couple more. But really this relationship between gut and emotion and data is kind of a complicated relationship. It's a lot more complex, I think, than some of our recent research might lead us to believe. 62% of business executives felt it was often necessary to rely on gut feelings and other soft factors while making decisions versus relying solely on data. This was done in a recent survey, 2018, by Fortune, and certainly substantiates and supports some of the concepts we're exploring here. And let us not forget about coronavirus. I know that would be impossible to do right now, but it kind of fits in with some of the concepts and themes we're exploring right now. In both interpersonal and intrapersonal communication and problem solving, emotions have that power to distort information and create perceptions that are biased and accurate, that I'm sure a lot of you have already come across. And in fact, our two folks here, Elon Musk and Bill Gates, on March the 9th, just a few weeks ago, in an interview they were doing for Inc. magazine, this is all available online, came out with a couple of comments about coronavirus. And Musk's was, the coronavirus panic is dumb. Gates's was, I hope it's not that bad, but we should assume that it will be until we know otherwise. Here's two very, very different responses, and it's kind of a lesson in emotional intelligence. Two brilliant minds, but one person is kind of potentially dangerous while the other one could save millions of lives. So what has emotional intelligence got to do with all of this? Well, it's about everyday life. It's about life-saving in the face of panic-inducing situations like coronavirus, because it allows you to keep emotions under control so you can make balanced and reasonable decisions. In this case, Musk and Gates's responses are important because they have colossal platforms, both of these guys, huge reach, and each can influence the way millions of people view and respond to COVID-19. Taken literally, of course, Musk's take on panic is correct. Experts advise one of the best things the public can do right now is to try and remain calm. The problem with his tweet is that its casual tone detracts from the seriousness of the situation. And it also undermines the work of the countless medical and scientific professionals who are out there trying to help us. So that's just one current example. I'm sure you can think of many others. What do we know right now? We know that neuroscience has taken a very, very important role in all of this type of work. And what we're seeing is that they can help us understand mindfulness applications in decision science and analytics. Neuroscience is adding that hard science behind what was considered a soft science in terms of mindfulness up until recently. Cognitive behavioral research outlines the neurological benefits of emotional regulation training as applied to decision making. So now we've got some more hard data coming in to support and substantiate these models. Through self-awareness training, we're cognizant that our thinking and problem solving is shaped by previous experience, environment, and the urgency of the situation. So we've got three really important fields coming together. But what we also know is there's common human instincts that can produce thinking errors and misinterpretation of the facts. So if we make the assumption that the facts, the data, have a high level of integrity and statistical robustness, then there's still some issues that pop up because we're human beings. Let's just quickly go through a few of these. Gap. The gap instinct kind of tells us there's an us versus them. And as soon as we start putting items, people, concepts, responses into distinct groups, we always are going to have some sort of chasm that exists in between, instead of looking at it as a total systems think. Negativity. This sometimes is referred to as the dramatic versus the worldview, where everything is bad news. We all know, and we have all experienced certainly, that negative concepts and emotions and ideas travel much faster than positive ones. So trying to frame that as we're looking at information and being aware of that instinct is important. There's something called the straight line instinct, which says the easiest way for us to conceptualize is to think about everything moving along a nice linear path from point A to point B. And in fact, we know that's not what life usually throws at us. There's curves, humps, parallels, normal distributions that stop being normal, etc., etc. The fear instinct, although sometimes it's very important to have, in general, we think of it as blocking the rational brain. So that ability to think rationally gets impacted when we're assessing risk and being afraid of things. Generalization, I want to approach that from two different directions. One is the overuse of categories. So when we're trying to put everything into a very nicely defined category, we can sometimes generalize too much, and those nuances that we're ignoring are really important pieces of information. The other kind of generalization that's lethal, for those of you who work in the analytical world, is taking sample data and generalizing it into a population response when we haven't really collected the sample data in a way that would allow us to do that statistically significantly. So there's a lot of rules about going from sample to population. The destiny instinct is really kind of the innate characteristics determine fate. That's just the way it is. Or life isn't fair, get used to it. That kind of concept undermines the ability to really think clearly. The single perspective instinct is saying there's really only one way to solve this, okay? It isn't complex. Everyone's trying to make it more complex than it is. Again, something that can get in the way. Blame. Let's not look for villains, okay? Let's look for solutions, and let's look at systems, not heroes. All right. Urgency. Okay, we got to do something right now. Sometimes that's true. Certainly with the coronavirus, the concept of urgency has really complicated the thought processes of all of our stakeholders and decision makers around the world, not just in the United States. And one group that can really use this in a very lethal way sometimes is our marketing folks. You know, buy it now. Oh, I guess we could even say the toilet paper situation right now, right? Go out and buy 500 rolls of toilet paper because it's not going to be on the shelves, and lo and behold, it's not on the shelves. So it kind of feeds into that bad decision making. And no matter what, no matter how urgent, we have to insist on robust data, which is really what we're trying to do in the United States with dealing with the coronavirus. Okay, let's quickly look at a couple of basic models that try to integrate a few concepts that possibly can be the foundation for more diligent and in-depth research. The first one is called the emotion regulation model, and I'm actually going to start with item number 3 here, the modulation of emotion trajectory. In other words, the emotional regulation has an impact on the emotional dynamic. That component actually got developed first, and it came out of some work that Thompson did in 1990. But then we had Gross, who went ahead and did some really important work in 2011 with our other two parts of this model, the activation of the regulatory goal and the engagement of the regulatory process. He worked with a couple of his colleagues, Sheps and Uri in 2011, and then later on with Etkin in 2011. But he's really given us a wonderful background in this concept of there's 3 moving parts in the emotional regulation model, how we regulate these emotions. And another little part that came out of all of this is, even although we understand this, there's a really important part we haven't done too much measuring on, and that's the ability to implement. Let me give you an example. Let's say we've got a customer service person in the U.S. who knows that cognitively reframing an interaction with a difficult customer is the best strategy. But that customer service agent may not implement it well during the actual interaction. So to say that if we understand fully how emotional regulation ability is associated with well-being and financial success, we also have to have some more research that helps us to examine the ability to implement the strategy to regulate the emotion. Another way to say that maybe is whether people can actually operate the machinery of emotional regulation. Okay, so what we're trying to explore a little bit more thoroughly is more of a systems approach, where we're trying to bring the neuroscience, decision science, and cognitive behavioral science all under one umbrella. So neuroscience, again, can explain what goes on in the individual brain and nervous system as we make decisions. They can measure that, they can show us that. Current decision science points to the limits of decision-making theory based on pre-existing frames of reference and knowledge. We have to expand those frames if we're going to roll in the concept of what neuroscience is presenting us with. And then the cognitive and behavioral researchers are helping us to develop strategies to structure decision processes designed in order to compensate for that flawed or restricted thinking. We have to acknowledge it if we're going to build it into the model and come up with a solution. So what we've talked about here to start with is really taking data analytics and combining it with mindful awareness. And when we talk about data analytics, we're talking about big data, of course. What is big data? Big data is nothing more than just having access to a lot of current updating algorithms that are providing us with information. We have to explore both the qualitative as well as the quantitative data sources. And of course, whatever data we're using, we have to be able to go back and make sure there's integrity with that data so it's safe to actually use it. Just because you have a lot of data, we all know it might be bad data, but you got a lot of it. That's not very useful. And sample theory, of course, has to apply. Have I collected the sample data in a rigorous, robust, statistically viable way that I can take that information and safely generalize to a population? In mindful awareness, some of the skills we have to focus on besides just emotional regulation are mindfulness, we've talked about that, but also resilience. And what we see in this field is a lot of kind of parsed out work in the three areas, but not a lot that integrates it. And what we would like to say is, let's take this, package it in a way that can really help with decision making. And some of the information we have to acknowledge in decision making is intuition, the data, past experiences, and mindfulness. All of that has to be taken in. We can't just look at the data and the mindfulness. We've also got to take in the human part of intuition and past experiences. So, what are our conclusions in this very exploratory paper? Recently, neuroscience has focused on ways in which mindfulness and working memory training can develop the brain's capacity for more conscious processing and open the mind to new and more creative possibilities. Great. So, what does that mean from a practical standpoint in the business world? Companies should invest in training models designed to restructure neural pathways so that flow of energy and information is enhanced and improved. Some of the models out there are the MBSR, or the mindfulness-based stress reduction is what it stands for. Originally designed to help patients manage pain, but it can be adapted and has been adapted in a worldview to lots of different applications and problems. Which means we should increase partnerships between industry and academia on this topic. As these programs are introduced into organizations, data needs to be collected globally so we can better understand what the return on investment is on this. We have to be able to better study that causal relationship. Hopefully there's a few causal relationships that may exist, and do it in a global way, which of course is going to mean that we have to take into account some of the culture norms. But this is not a utopia. We know that there's some challenges and limitations. Mindfulness and emotional regulation training models may be difficult to appreciate and use with data analytics in a multicultural or global context. Not impossible, but a lot of my previous work in the global context has really made me aware of how we have to fine-tune a lot of our processes and systems thinking by taking into account those cultural norms and values and beliefs that exist. And when I talk about culture, I'm not really just talking about national culture. Joanna and I have both done quite a lot of work in organizational culture and professional culture. And so we need to think about culture even in a much wider context. There needs to be more research in applying useful training at the intersection of data analysis and interpersonal relationships. It all sounds wonderful, and there's groups out there that are certainly working on the interpersonal relationship, but we need to bring together data analysis people with skills in that arena to work with the folks that have the skills in the intrapersonal relationship arena. One of the decision makers, when we talk about bringing people together to work in this kind of a mixed model, if you will, needs to be willing to engage unilaterally with the expectation of reciprocity, even in the face of adversity. So you can't go in with the idea that I'm going to make this one decision and there's not going to be any kind of reciprocity, especially when things get challenging. We know that sustained intrapersonal relationship health requires trust, reciprocation, and mutual understanding, none of which come easily, but are certainly easy to lose in a heartbeat. So all of these are not overwhelming, but they're items and factors and parameters that have to be addressed. So for us, what are our next steps? Well, we've got a lot of room to grow in this arena. Of course, right now, what we would love to just hear from all of you is this an interesting field? Do you think there's some work that should still be done in a way that's going to benefit companies and organizations? And so we think if that's going to happen, there has to be more data collection that goes on to help build even more exploratory models. We're not at the point to start doing confirmatory analysis just yet. We have to fine-tune the existing training models so that we can actually get measurable outcomes. If we haven't got metrics that can be substantiated statistically, then it's going to be hard to build a database to go back and look at the viability and the ROI on those training models. And then we have to develop clear algorithms for calculating that ROI. Return on investment is certainly a very popular term in the world of business, but measuring it sometimes can be a little bit more difficult, especially when we're working with some of the soft science part or the behavioral part. And with that, this is our concluding slide. Data informs the decision, but decisions cannot be made in a vacuum. Thanks again for taking the time to listen to our presentation, and we look forward to communicating with all of you, even if it is only online right now, and we'll hopefully see you at the next conference next year. Signing off, thanks so much, from Linda and Joanne.